class. Welcome to the second week of our class and the second Fresh Brew episode. I am going to talk to you just a little bit about some of the things that was brought up in Module 1 and then talk a little bit about what's going to happen in Module 2. So I really enjoyed reading your posts about your beliefs and thoughts about addiction. And it's really interesting. I just get to see those. The rest of the class doesn't. And so you brought up so many good things in there, some of you, that I just wanted to share a couple of things. So, addiction, is that really the best word? Our materials for this module say that that's really an imprecise word, right? And it means lots of different things. And so we can say we're addicted to coffee, right? And not even the caffeine in here, because there's no caffeine. I don't do caffeine, but just the taste and kind of the whole ritual around coffee. And so, or we can say we're addicted to some type of substance that really causes lots of damage in our life, like alcohol or drugs or, prescription medications, that take on a whole nother meaning. And so I really like in the book, how it talks about we need to be more descriptive and use less stigmatizing language. And so I would just say that in our book, this one here, The Science of Addiction, the definition that we will use throughout this class, or that I want you to just have in your mind around addiction and how we as counselors treat it, comes from page 6. And it really talks about the American Society of Medicine, ASAM, which is, kind of the gold standard in our profession around addiction counseling and services. That addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. And so we're going to get into that more next module about the brain and how all of these things affect our brain and how it really is a disease. And that's the main thing that I want you to come away with in terms of the describing somebody who is abusing or using substances. A disease, where we talk about it as being a disease that's not just a medical disease, but also a disease, right, that creates dysfunction in circuitries in the brain that leads to characteristic biological, psychological, social, and spiritual manifestations. So there is this piece around the whole psychosocial aspect. So there's psychological things that go on. There's social things that happen. Relationships are impacted. And, the last thing here, that it's reflected in an individual pathologically pursuing reward and or relief by substance use and other behaviors. And so there's this pathological drive to use substances and to use those to produce rewards, which is really a brain process. And so then it goes on. I just really would encourage you to read that. So it's a very complex issue. It's not just one thing, right? And many of you wrote about that in your journal reflections, and they were great. What you wrote is perfect, and the submissions were good. A couple of you did videos, which was really awesome. I got to see you and hear you, which helps me get to know you. And so I would encourage some of you to try that as we go forward in these modules in the journal reflections. All right, the other issue that somebody brought up in the reflections was the whole idea around the psychosocial aspects, and that's about people who have substance use disorders being tied into being criminals. And so does, mandating treatment really work? Should we be doing that? And, are they criminals? Is there disease? Does that make them criminals? Is it criminal to have an addiction issue? And so I think there's two things from that. One is that we really have to look at treatment as an option for people who get into trouble with the criminal justice system, but we also do have to look at accountability. And so if you've broken the law because of your substance use and your addiction, your disease, you have to have some accountability for that. And so it's a both and, which gets kind of sticky sometimes. Stigma is huge. You've read about that. We have to be careful about the language. Even when I'm typing, I always want to say the addict, this, and this. but that's not really good language, or that enhances stigma actually when we label people that way, and it's that implicit bias that we have towards that. And so one of the things it talked about in the book was challenging yourself around those terms. And so I would just challenge us to use words like person in recovery, person struggling with a substance use disorder, rather than addict. And so just try to challenge yourself and maybe check that when you're doing your assignments. All right, so next week, what's going to happen, or this next module, we're going to be talking about the brain. And I do have an opportunity for you if you want to see a webinar. I'm going to give a webinar to the International Association for Addiction and Offender Counselors, and it's all about neurocounseling and recovery and the brain processes. So if you want to sign into that, I'll put up a link. It's free, and you can join in on that and hear some of the things that goes right along with this module. So it was great timing. Keep up a good job. It was fun to read all your introductions. I'm so glad to have all of you in class, and let's keep studying and learning together. So if you have any questions, shoot them to me on the general question discussion board, and I'll keep checking in. So thanks, guys. Have a great week. Bye-bye.